Holistic medicine. My name is Dr. Kenneth Woliner, and I am a holistic family medicine doctor. Well, what does that mean? Well, family medicine means outpatient drugs and surgery, and even though I do admit my patients to the hospital if they ever get that sick, I mostly treat people out here in my office. But why am I called a holistic physician? Well, most family medicine doctors use drugs and surgery. So prescription drugs that you get from the pharmacy, as well as some surgeries, we refer people out to surgeons. However, there's other things that are involved in people's health too, such as behavior changes, diet, exercise, supplements that are available over the counter, natural hormones. These things are also useful to take care of people. I think they're important, so holistic means I treat everything. How do I get into a holistic practice? Well, when I was in medical school, they would give lectures about different conditions. In week one, they'd talk about high blood pressure, and they say that you could die from this, you could get a stroke. And you would check your blood pressure. If it's high, we'd try diet and exercise for 3 months. When they came back, they would say, hey, your blood pressure is still high, we have to put you on different medications, but these drugs have side effects. And out of an hour-long lecture, the doctor, professor, would say, 45 minutes, all about the drugs and the side effects. Week two, they'd talk about high cholesterol, and they'd say that this is dangerous and people get heart attacks. And I said, well, what are you going to try? They said diet and exercise, but if they come back in 3 months and their cholesterol is still high, we have to put them on their drugs. And the drugs have side effects of liver damage or muscle aches. So they spend 45 minutes talking about those drugs. In the third week, they're talking about diabetes, and that is dangerous and people could go blind. And they say try diet and exercise for 3 months, but when they come back, we have to use different medications. And I'm raising my hand and I'm saying, when are you going to teach us about diet and exercise? And the professor said, I just did. And it was all lip service. There's more to diet and exercise than just saying try eating less and exercising more. So I learned how to be able to do that with my patients, to teach them exactly how to be able to food shop, and how to be able to cook, and how to be able to eat healthy food that tastes good and enjoy it, to look forward to it. I taught people how to exercise without getting hurt, to be able to build muscle and lose fat. I teach people about supplements because even though it might be over the counter, it is also a useful therapy for some of these conditions, whether it be high blood pressure, cholesterol, diabetes, or otherwise. And so a holistic practice means you teach about everything, not just drugs and surgery, but everything that you could think of that will help the patient get better without hurting them.